Hi Tyler, it's Dr. Hom. I thought I'd spend just a couple minutes talking about your draft for your part one. So what I'm doing is just looking at the rubric that's associated with the project. So the first one is evidence of scholarly writing. This one's a little bit tricky because obviously you're not writing a lot. It's what's on the PowerPoint. So as you go through here, and I'm assuming some of these things were just stuck in there and are not in final form. But for example, just your web links at the bottom of this page, making sure that you have your citations correct both within the presentation and then at the very end here, you just need some tweaks to get it to APA format. So my second comment is for the included learning objectives, make sure that these are student or learner centered, again using that Bloom's taxonomy. So what is it that you want the student to be able to do? You pretty much have a list of the components of your presentation, but not the outcomes. So that should just take a couple minutes to retool your learning objectives there. So the next one says content presents current, practical, and clinically oriented EVP incorporating an interprofessional perspective. So here it's a little bit difficult because I'm assuming that you're going to say a lot of things that aren't on this slide here. Your presentation, if you do a voiceover, is probably 20 to 30 minutes. So that looks like you probably need additional content here. It's good to start with that brief overview like you've done, kind of giving clinicians a reason to care. Basically, these patients are in primary care practices, so starting with an overview, and then you go into things to watch for, so signs and symptoms here. So you probably just need more of the content here, and I'm assuming other things like you're going to maybe put some visual graphics in, and just organize the slides a little bit so they're visually appealing and things like that too. So I think in between here, you probably need to mention the next one is discuss topic in relation to comorbid or complex illnesses here. So I think you need to weave that in a bit more. Obviously, these are very complex patients, but talking about what happens, are there any concerns, if they've got lung issues or, diabetes or hypertension or things like that. Definitely they're high risk. So a little bit more about that. And I see that you do have some integrative medicine, at least some information here. And as you said, no evidence that herbal therapy is a success. That's great. You can also talk about, common things that you've seen patients try that aren't helpful, or maybe what's down the pike, or maybe some areas that need to be studied to get that evidence so that we can recommend. Also think about, as far as integrative medicine, do these patients also need things like psychological support, dietary support, so other team members that may be essential to treating the whole body. That's often what we think about integrative medicine. So I think you have a good start here. The take-homes are just cleaning up the APA and the look of your presentation, like I said, which I think you're going to do anyway. Adding some more content, and then, but I think you have a great start here. If you have any questions, just give me a call. Thanks a lot.